Hi, everyone. I'm Kate Fulb. I'm Director of Hollywood Health and Society, and we're here today during our Lunch and Learn to discuss a really interesting and sometimes frightening topic of AI, in particular, AI and how it can support aging and living with independence and dignity. But before we start our discussion, for those of you who don't know Hollywood Health and Society, we're a free resource to the entertainment industry on all issues around health, safety, and security. You can call us for script consultation, for quick facts, or even to connect with experts like we're going to be hearing from today. To help with the development of your scripts and projects. If you need some accurate information to make sure that your storylines are as accurate and up to date as possible, we have the means to help you, and we don't charge a penny. So please be sure to reach out to us at hollywoodhealthandsociety.org. Today's Lunch and Learn and a few more that we have planned are in part in service to our Blue Sky script writing contest, where we're offering prizes to screenwriters to develop pilots for shows that take place in the near future, starting in 2045 up to 2100, but that are set in a world we might actually aspire to live in, like one that's more peaceful, where we've had some successes in adapting to and mitigating climate change. We live in a world that's much more racially and socially just. Your story can be about anything, but we want to see it set in this kind of a world so that we can start thinking of beyond the dystopian hellscapes we're so used to in our futuristic stories. So this is one of several Lunch and Learns and other events we're doing to help get your juices flowing if you're planning to compete in the contest. Deadline to submit is August 1st, and you can find out more information at our website, hollywoodhealthandsociety.org. So today, we're going to talk about aging and AI, what the future holds for all of us. And in fact, you know, an older person is someone in all of our futures. So it's not something for someone else. We all have to think about this. And I'm delighted to have our two panelists here to discuss not only the topic of aging in general, but the topic of AI and how AI might be able to affect our journey as we all tend to grow older. So please welcome Sarita Mohanty. She is from the SCAN Foundation, and Amelia Jaworski, who is from the Future of Life Institute. Both of their bios will be in the chat, so please take a look there. They have illustrious CVs and bios, which if I were to start talking about them, we wouldn't get to the topic at all. So please check the chat and you'll see how fascinating these two women that are with us today are. So welcome, Sarita and Amelia. Thank you so much for being here. I'm really interested in this topic. Yes, I'm a woman of a certain age, so it's personal as well as professional. But I want to start with you, Sarita. Can you tell us a little bit more about the SCAN Foundation? What are its goals in general? And then how you see AI as kind of being a part of your goals.
Great. Yeah, happy to. Good afternoon, Kate and Amelia, and those that are participating on this webinar. It's really a pleasure to be here. Such an important topic, and I want to thank first and foremost our partnership, with Norman Lear's Hollywood Health and Society. It's been longstanding, almost 7 years now. So, and you asked about the goals of the SCAN Foundation. Hollywood Health and Society has really helped played enormous role in amplifying the key kind of priority topics and foundation goals in aging to the entertainment industry. And we're really, really committed to changing the narrative and understanding the needs and challenges of older adults. So, our goals as a foundation, we're an independent public charity. We're devoted to transforming care for older adults, really in ways that promote equity, dignity, independence. And so we really see a future, and I know we're going to be talking about the future of high quality, affordable health care and supports for daily living that are, basically defined or designed on each person's own terms according to their individual needs, values, and preferences. And I would be remiss if I didn't mention the challenges that we're dealing with right now. By 2030, more Americans will be over the age of 65 than under the age of 10. And we are going to, the next 8 or so years, where the oldest boomers will reach age 84, and the youngest will be eligible for Medicare. So we are seeing a massive demographic shift. And honestly, I as a practicing physician myself, I think the system is fragmented and it doesn't really offer the true care coordination that we need. So we think that this is an opportunity, as we really need to think creatively and future state about what we need to do to help. Particularly, the one thing I will also say is that we are also dealing with a diminishing workforce, direct care workforce. And so when you ask me now about what you think AI can do, it could help us in where it can come in because it can substitute for some of the fact that we don't have we have a shortage in terms of physicians and other direct care workforce. So basically what I would say, and then I'll certainly turn it over to Amelia to add, is that I see AI as kind of really galvanizing and revolutionizing many aspects of health, public health, medicine, and also the social aspects of health. I would be, it's really important to us to think about, when we think about health, it's not just the clinical, but it's also the social, like how do people get food? How do people develop economic security as they age? Those type of things are going to be really important. And, AI can help predict those risks, whether it's social, behavioral, physical, deliver education and promotion of key things. If a diabetics whose sugars are out of control, how can AI really understand that right away and offer and push information or be more interactive with that individual? And there's so many things: personalization of care management solutions, reminders about when to take your medications. So I could go on, but I know we'll have more active discussion on this. I just think that the future is bright, and also we have to think about it very thoughtfully and carefully. So thank you.
That's really great. Yeah. And well, okay, I'm going to turn it over to Amelia, because I know she might have some more specifics in terms of the kinds of tech that we're already using that we don't even think about, in terms of that it's kind of AI, or we're getting there in terms of that, and how it already supports our lives, and then what we can expect in the near future.
Absolutely, Kate. So my background is I'm also a physician by training, but I've landed more on the technology side. So think a lot about how emerging technologies are going to really shape healthcare in the future and sort of all aspects of our lives. So I think that a bunch of great applications of AI that are really available today have already been mentioned, talking about things like remote monitoring of patients so they can stay in their own home, things like predictive analytics, so we can predict when people are going to get sick before they do. And so that enables us to intervene earlier and have people have better outcomes. I kind of joke it's like the Minority Report for sickness, is one way to think about that. I would say some other maybe more related to life aspects is we hear a lot about VR and virtual reality and augmented reality, and what opportunities that may bring in terms of experiences and enriching daily lives to people who may have limited mobility, where they can't go out and sort of experience those things or travel or go places, being able to bring enriching experiences into the home. I think AI is also being really used on sort of when we think of technologies and ways to help patients in the future on the drug development side. So how do we think about developing new therapies to treat many of the disorders that we think about that are related to aging? So common things like Alzheimer's disease, like osteoporosis, like heart disease. And what I think is really exciting is before we had AI as a tool to make sense of all of this information, we really were looking at developing new therapies as sort of a one at a time approach and in very narrow ways. And now we have the data and the AI tools to start thinking about how do we look at the biology of aging in general and understand what are some of actually the root causes of all of these diseases? And can we develop new therapies or new interventions to actually slow down the aging process? And as a consequence, help to prevent a lot of those diseases that we all so commonly associate with old age. So I think it's going to be a really exciting time, not only for how AI is going to solve some of the problems we think of today around aging, but also help to prevent some of those problems from coming up in the first place as we look towards the future.
Yeah, I read somewhere that, it's thought of that aging is really just a series of diseases or illnesses that happen. And so if you can prevent, like you said, Alzheimer's, osteoporosis, that kind of a thing, what is that gonna do for our lifespan and so forth? And I'm sure looking at one of the things that Hollywood Health and Society is doing in partnership with the SCAN Foundation is to help people understand that, older people aren't just feeble and, unable to make decisions or unable to interact with technology and all the tropes that we see around. And so there's dignity, there's independence, there's also productivity. I mean, the Norman Lear Center, our namesake, Norman Lear is going to be 100 years old next month, and that guy goes to work every day still, so it's changing that perception of older adults. And do you think, Sarita, that AI can help with that, or is that gonna is it going to take over and usurp a role that an older person still might be able to contribute to society?
Yeah, no, I think there's some tremendous opportunities, I think, in this space. I mean, you talk about productivity as a great example. Think about an older adult who is retired, maybe that's a forced retirement, and but yet still has a lot of, wants to do more or wants to learn. And how are there opportunities where AI could identify, the desires to build skills, for example? I mean, you see some older adults who are getting their PhDs in their 80s and teaching, or like I just talked, in terms of vitality, being more vital in society. I was talking to one older adult who decided that, he was working in the industrial side and wanted to learn tech and coding. So he actually went to school and learned how to code, and he works for Google and is doing some coding. I mean, it's fascinating. So I think, AI, there's a lot of things that can be demonstrated. I think we're starting to see that, like how to build resumes and get information to help then get them to the next phase of their career. And I think you hit on something, Kate, that I think is really important, is that we want to use AI for good. So how do we think, look at it as a way to look at all the positive aspects of aging versus not just the medical aspects of, disability or deterioration. It's like, what are the things that it could help advance, like health promotion, but also emotional well-being, physical well-being. I mean, there are so many things out there that could benefit from this type of digital technology.
Yeah, and I think maybe we want to back up for a second and define AI a little bit better, just for me, maybe the rest of you out there already know. But I mean, AI right now is being used to just crunch numbers, like you were saying, Amelia. There's so much data that we have that would, it would take humans a lot longer to sort of process and make these decisions, where AI can just process it all in a few seconds or minutes and give you, some results right away. All of that is fascinating. But what are we talking about when we say AI? Everything from crunching data to actually being a companion for someone who lives alone, right? And maybe you can talk a little more about the span of AI.
Yeah, so the way I like to think about AI is kind of like an artificial brain. And the ones that exist out there have varying degrees of how powerful they are or what kind of tasks that they do. So sometimes you create an artificial brain to basically make sense of a lot of data, right? And tell us what are some trends in this data that we wouldn't normally see. That's kind of the most basic form. We've now been seeing things in the news, like you may have heard things about AI being sentient, or these language sort of generator systems where you can also interact with the AI and ask it questions. And these are AIs that are sort of a lot more powerful. There's a lot more inputs, and they are structured to think around a broader range of tasks, is one way of thinking about it. And so that sort of artificial brain and thinking to perform tasks can be coupled with anything. So it could be coupled with a robot, like in the case of sort of the personal care robotic side of this. It can be coupled with creating virtual reality experiences and actually generating sort of experiences and images and tools that previously a human software coder would have to put input, right? And what's exciting about that, to the point of how do we think about aging beyond healthcare, is this ability to now create custom experiences, custom software that's developed for an individual's personal goals and also an individual's personal limitations. So previously that'd be a really expensive endeavor to say like, hey, I want to create a language learning program because someone wants to learn a language that's ideally suited for each individual's learning capabilities, right? Whereas like now with AI and how it's developing, like that's something that you could create for someone. Or to tell an AI like, hey, I've never been to Africa, I want to experience like us being in the Serengeti and on a safari. Like we're getting software that can create those custom experiences for people. And so I think that's a really exciting piece of this too. People at any age, but especially at older ages, to be able to navigate the world and navigate experiences in a way that's potentially customized to them, because software is going to become so cheap and powerful in what it's able to do.
Wow. Oh my gosh, so many questions about, then of course we can get into the issue of trust. So let's say I'm an older adult and I want to go on safari in the Serengeti. How do I, there's a whole level of oversight on, is this accurate? Is this, I live in the world of trying to depict things as accurate as possible, but I can, then there's a whole other level of misinformation could happen. We won't go there today because that's not our focus, but
I do think something you said there was key, Kate, which was trust. And that's something that we think a lot about at the Future of Life Institute as we build ever more powerful AI. And the two attributes we talk a lot about are trust and loyalty of those systems, and making sure that that loyalty is to the user, the person that is using that system, not necessarily always to the goals of a creator and what they might want to input, and how to make sure that as we develop AI, it's aligned with our values, right? And aligned with the goals that we want to accomplish. So those are two key things to think of, is trust and loyalty are a big part of this.
And Kate, I would also add, I think this is a really important conversation. It's like, I think this is related to the trust and loyalty, Amelia, that you mentioned, which is how to ensure, like, when you're getting all this information and you're giving information to a recipient, an older adult in this case, how that loop is being closed so that they're actually getting the service. Like, how do you determine that they're actually getting what they need? Like, so then maybe there's I think it's important to be able to, as we do this, go through this AI journey of evolution or journey, is monitoring what kind of outcomes are we seeing from this type of support. And because I would say as a clinician too, like I've witnessed where we collect all this information and then you find out later on that information wasn't acted on. meaning either whether it's the clinician or a social worker or anybody else, family member, something got lost in the shuffle. So how do we ensure that that doesn't happen?
Yeah, and I think that comes to one of my questions for both of you is, what are those risks around AI for health and aging? What are things that we do need to keep in mind as, this, as it continues to grow and be more part of our daily lives? Are there things beyond, you mentioned trust and loyalty, reliability. Who's programming the AI and what are their biases? So I don't know if we covered that or if there's anything else either one of you want to say about that.
I think maybe to add to Sarita's point, there's also the idea of explainability. So one of the big problems with a lot of the AI systems that they're structured today is there's something called black box systems, which means we input a lot of data, we get an output, but we don't actually understand how the AI made the decision that it did or how it made the recommendation that it did. And so to the point of making sure that your outcomes are what you want them to be, we also need to be designing systems that we actually understand how they're making decisions and how they're working and how they're processing the data. Because if we're not getting the outcomes we want, we need to be able to go back, right, and understand where is this going wrong and understand what the system's behavior is.
Yeah, I can see a case for having older adults learning to code and so forth. Just like with writers' rooms, you get more diverse stories on TV when your writer's room is more diverse. Yep. I could imagine if you have programmers that are experiencing growing older themselves, they're going to be open to or going to be thinking about things that maybe a bunch of young programmers aren't, that would, then be able to be input into the AI. Sarita, you look like you wanted to say.
Well, no, I think this is building off exactly what you're saying, which is, I think, one of always the questions or concerns that comes up when we're thinking about this technology that, is, and I've heard this phrase, digital ageism. And I'm sure, Amelia, you think through this or talk through, work through this a lot. It's because, when we think of ageism, and this is one area that our foundation is focused on, is how do we reduce, mitigate ageism, which is, kind of that bias that exists, that, there's these kind of prejudicial attitudes or discriminatory practices around older adults. And it's actually an issue that I think is still we're looking at more and more in telehealth or remote monitoring or AI, because what we're finding is a lot of older adults are being excluded from the development of this technology. So their insight is not being incorporated. And so you're actually perpetuating or worsening the biases or the prejudices against older adults. And so it's, I think, my take home message on all this is that, if anything, it's really critical that we look at the, kind of future of AI and make sure that older adults are incorporated into the development and research, because otherwise it could worsen things and, widen the inequities or that exist. So that would be my message regarding, kind of dovetailing on what you said, Kate.
Yeah, that's great. I just want to mention to everybody listening or watching that if you have questions, you can go ahead and put them in the Q&A function whenever they occur to you. We'll definitely allow some time at the end of the discussion for questions, but go ahead and put them in whenever they occur and we'll get to them. Yeah, I was just thinking of, in terms of storytelling, writers like to sort of challenge stereotypes in a way. And, I could see some AI specialist that's coming in to give a presentation, and it's an older woman versus, some young kid in a hoodie, giving their, and just, realize that older adults can and do understand this stuff and need to be able to understand this stuff and to interact with it, because it's going to be a big part of their lives and all of our lives. another, speaking of the generation gap or the differences in the generations, and we sort of all think of, I'll never forget when I was trying to figure something out on my computer many years ago, when computers were new to all of us, and I was banging my head against the wall, and my 4-year-old son came up and said, "Oh, just push Control Q, mommy." And and it was, I don't know where he got that. I have no idea how he learned that, but it was just innate. So I mean, we think about younger people and that they just know this stuff, but they have to learn it too. But how do you see kind of the intersection between generations in terms of AI, but in terms of also just in aging in general, and how that can be of benefit? We sort of think of them as different populations and that they never interact. Whereas, of course, we know that's not true. And certainly in storytelling, we can tend to see that as well, sort of the separation versus the interaction. So love for either one of you to comment on that. Maybe Sarita first.
Yeah, no, when we think about aging, and I think this is such an important topic, and actually our foundation, we don't actually put a number like 65 plus or 55 plus or 80 plus. We always see as aging, it's a continuum. It's all ages, all stages, right? And so when I think fundamentally what we hope is we're building this movement that looks at it, from whether you're a 4-year-old all the way up till you're 100 plus, right? We're all aging, right? And I think what AI can do is really support the connectedness across generations first and foremost, and the awareness of, or even like, if I'm 40 years old, or 30 years old, what do I need to be thinking about to plan for my future economic security as I am getting old? There's so many aspects that I think that we're trying to make sure that everybody who's aging, whether they're in their teens or older, that they recognize that this is all part of a process, and age is just a number. And so I think that's something that we want to change that narrative. And I actually think when you're co-designing these AI solutions, we should take into account what is somebody in elementary school or middle school or high school think about the aging process when we're thinking, so I think those perspectives are also really, really critical to reduce that stigma. And like you said, how do they understand that, one's aging is so critically important, and it's not necessarily a bad thing, right? Like, so that's kind of where I see some real critical opportunities to bridge this divide across generations. So.
Yeah, I'd add to that I think debunking sort of this bias of digital ageism is super important, and also is just going to become, as time goes by, increasingly irrelevant. Because a lot of this has to do with like who grew up being digitally native versus not, and when did the computers come online, and now it's everywhere, right? And so as people get older, you have everyone now with experiences of technology, right? So I think that we now live in a world that is digitally native. And I also think that we're living in a world where there's got to be a lot of technological change, and a world that's ever more complex. And so when thinking about things like how do I plan for the future, it's getting more and more overwhelming in a lot of ways, because the paths that maybe or ways we thought about the world before are becoming a little bit different as we see new technologies come online and how they're just transformative they are in changing the world. We think about we didn't have computers really broadly available 30 years ago, and now we all have this in our pockets. And how has that changed society? How has that changed how we interact with each other? So I think an also important role that AI can help is almost being like a sense-making tool of all of this complexity in the world. And it's almost like sort of your computer program friend, or some sort of tool that's available to everyone to understand, these are my goals for my life and how I want to live and age and be, and how do I connect that to a world that can maybe sometimes be overwhelming to navigate. So I think that's on the planning side, where AI can help kind of make sense of things and help really empower people to think about the life that they want to live and connect them with the best ways to live that across generations.
Yeah, how about some concrete examples of how AI, I mean, you've given us some,
Yeah.
how AI can support all of us as we age. I mean, I'm looking at the image behind me and thinking, okay, if I have a stroke and I lose the ability to use my right arm, can they replace it with a robotic arm? Or, I mean, is that a thing that we're going to have? And is it going to be plugged into my brain, kind of like cochlear implants that are, to help people that have hearing issues, and it plugs right into their brain and they can hear? And of course, there's debate around all of that. But I mean, what are some concrete examples? That doesn't have to be turning us into a robot yet, but of things that are either already out there or are going to be out there soon.
Yeah. So one thing that I would say that's like an aspirational thing that I think is doable with today's technology, and it's a matter of sort of finding the right form for it, is almost having sort of like a loyal AI personal assistant. So basically, I would call it like Alexa that works for you, is sort of one way to think of it, of like someone that you have that trust in that can like help you navigate all of those complicated, from everything, from the little things in life to like, how do I get a mortgage to, and have confidence that that system that you're interacting with is actually answering all these questions and helping you navigate in a way that's your best interest. So that's kind of on like the social side. I think on the robotic side, we're seeing tremendous improvements in that, Kate, in terms of both like assistive devices and exoskeletons and how to help people, improve mobility and walk that were maybe paralyzed. Like all of that sort of stuff is pretty amazing and relies on a lot of AI sort of underlying it. I think the predictive analytics side of this is huge, of like being able to monitor people's health and predict if they're going to get sick before they get sick. And I think that is just going to change. So in the future, hopefully you're never going to have that stroke in the first place, because there's enough monitoring to say based on your, sensors, wearable sensors that you have that are connected to your smartphone that say like, oh, Kate's blood pressure is really uncontrolled, you need to go to the doctor, right? And so hopefully that averts you from getting that stroke. So those are just some examples from like the social side to like the healthcare side of where AI is actually already being used.
Yeah, no, I think I love that, Amelia. And, I was reflecting, I was learning more, talking to folks at Stanford who are looking at what they describe as artificial intelligence for elderly care. And there was one example that I think is a really good example. It's using, and they use human-centered design. So they really design with the recipients in mind, and they incorporated that with AI-based technologies to improve caregiving for older adults. And what they did, and this is happening not only in US, this is like internationally, I think in Thailand and other places, for example. So for example, it's like this, there's this kind of hardware actually that is like a computer vision system that gets set up in somebody's home, especially if somebody is living alone, older adult, and it monitors their mobility to see if they're walking in a stable way or if they're falling in their bathtub or shower, especially when caregivers who often have to have other jobs can't be there. So they have this monitoring. So it's almost like, you think about, we have cameras for babies when they're sleeping in their beds. It's kind of like that concept of being able to monitor and say, okay, somebody's at risk. And one thing that came up that was really interesting in the human-centered design that I learned is one of the concerns from the older adults' perspective was that I don't want them to physically see my body or see me. So they made them as stick figures so that they would be monitored, but as a stick figure. So it's kind of some of that anonymity or, like privacy, whatever, but it took that into account. So I think that's a great example of something where AI can be so helpful, not only to the individual, but the caregivers in this case who are supporting them.
Yeah, and I think, the other thing that we talked about, well, you talked about it a little bit, Amelia, your personal assistant, but pets and just social and friends for people who live alone. Or, I mean, I think, if you've watched any television in the last 6 months or so, you've seen that. I think it's actually a car commercial, but there's a little robot dog that falls in love with the car and chases, and jumps into the car, whatever. I mean, but I think those are kind of available already. I mean, and probably a good chunk of us in this room have a Roomba or some sort of robotic vacuum, right? So those things are already there, and can kind of support not only the physical issues, but social and organizational and all of that, which to me is really fascinating. Oh, and I guess there's virtual companions now. You can have a chat bot that actually can help you manage your plans or your medications and that kind of thing, but also can just talk about baseball with you, I guess. Is that right, Amelia?
That is right, Kate. And I think that we're seeing, with these, especially large language models that we're seeing sort of come out of a lot of the leading tech companies, it's starting to get better and better. So I think people's previous experiences with chatbots or interacting with online systems is like, you can pretty much tell that you're not talking to a person. And you see how buggy they are. And those bugs remind you that like you're still talking to a computer. But with some of these large language models that have come online, like they're capable, these AI systems, of telling jokes and humor. And so that's, it's on some levels like really exciting for the potential of that, but also really scary that like that power is now in systems that we may not actually understand how they work. But yes, all of those examples are certainly true. I think the other piece of this that we think a lot about is just because we can use AI for something, should we? And because AI can replace humans for some things, should we do that? Is that what we actually want as a society? And so I do think there are things like the monitoring side of this, taking your medications, that like everybody would say like, yeah, if there's ways that technology can help do that, that's great. These robotic devices to help you walk, help you hear, right? The cochlear implants. But I think there's other pieces of this is like, do we still need human interaction? Can we actually make that replicate that experience in AI? And actually, do we want AI to do the other tasks so we can free ourselves up to interact with one another more? And so maybe the piece of it isn't necessarily AI replacing the human interaction, but maybe AI helping to free up the bandwidth of everyone so they can spend more time interacting with their loved ones across generational lines.
Right. Good point. Just because we can, should we? And that, I mean, I even made a note here when you were talking about predicting disease. It's one thing to predict disease, but predicting someone's demise, do we want that? Do people want to know that? I mean, it does take us down that road, right? But I wanted, there's a couple of questions, one of which I wanted to get to. Justin says, can you speak to AI and how it can mitigate something like Alzheimer's? And I guess this is also, can you also give examples of things where AI can become harmful, i.e. being weaponized for war? Okay, so same guy asked two different questions. Let's start with the first one and then we'll go to the second one.
Yeah, I don't know if Amelia, you want to start on that one, because I know you mentioned, especially with the drug discovery work as well.
Yeah, so I think there's a couple of ways we can think about AI and diseases related to aging, like Alzheimer's. So one of them is like developing tools to detect things earlier, right? So actually detecting the signs of Alzheimer's before maybe we even notice them, or loved ones notice them, or clinicians notice them, and that could enable earlier treatment. I think the other piece of this is, so that's like a diagnostic, an early diagnostic for Alzheimer's. I think the other piece of this is the therapeutics of how can we use AI to crunch all of this data we have about our genes, our proteins, the metabolites in our blood to actually get a picture of what this disease really is and what's causing it. And I think that Alzheimer's is one disease. cancer is another example, heart disease, osteoporosis, that are all very much more common as we get older and are thought of to be diseases of aging. And so this idea that AI can start to look at what are the commonalities around all of these different diseases of aging, looking at all this data of what's going on in our genes and our proteins and our cells and taking it together to start to identify what are some shared root causes here, and can we actually stop the aging process or help to slow the aging process by targeting some of these root causes. And I think that's really exciting in both in terms of sort of preventing those diseases, developing new drugs that target the specific diseases, and then also potentially helping to give us more healthy years, right? Because if we could slow down the core pathways around aging and understand what those are and what the interventions would be, the drugs would be to help do that, we extend our health spans. That's a word we use a lot, of like the number of years that you're living healthy. And then we think of our lifespan as the number of years we're on this planet. And I think something everyone can get behind is we want to live more healthy years.
Yeah, yeah. Anything, Sarita? Or I have two kind of both organizations, the SCAN Foundation and Future of Life Institute, have some exciting ventures that you're into right now that I want both of you to share, but I'll let you do that now and then we'll go from there. So Sarita, tell us about Alive Ventures and what that's all about and how that fits into SCAN's goals.
Yeah, thank you. So Alive Ventures is it's actually a for-profit subsidiary of the SCAN Foundation, was started in 2020. It's a venture studio. And it's basically what we recognize is that, it's all these, there's older Americans' needs we've talked about today, and that there's a real necessity for products and services for older adults that was largely unmet. And oftentimes these like products and services that are developed for older adults are often not co-designed or developed with those older adults. It's usually like the health plan or the medical group or maybe a caregiver, a family member who's designing them. So the idea was to have a startup, kind of a venture studio that, kind of allowed us to design for older adults with older adults. And basically what it is very early, it's pre-Series A, pre-Series B kind of support, like, let's conceptualize an idea, or there's a concept, let's like use this incubator of older adult communities to come together and help them shape the idea further so that it eventually could get more funding down the road. And part of it is also bringing entrepreneurs. So the entrepreneur in residence that come in and they actually have ideas, and then they can use this incubator to help generate them. And we actually, as a foundation, are one that we provide some seed funding if we think the concept or the idea is something that could be scalable. And so that's kind of our approach. And the things that you're talking about today, Amelia, in terms of all the different AI supports, these are things that we would love to help support or generate, more excitement on, and through the use of a studio like Alive Ventures. So that's one example. We just helped support very early seed funding of a company called Socialize. It's a community it's a community for creators of all skill levels where they get to learn how to use social media and tell their stories, and they can and making sure that social media isn't so complex, and they can try to create new things. And that's an example of something that is being incubated through Alive Ventures.
Very cool. Okay, and then our screenwriting contest that I mentioned at the top of today's discussion, and that some of you out there know about and hopefully are planning to submit for, was actually inspired by a world building contest that Future of Life recently held, in which they invited scientists, engineers, futurists to create worlds, future worlds. And the parameters were somewhat similar to the parameters we're doing for the screenwriting contest, but that has to do with a more peaceful world where AI is not being used for weapons and other things. But anyway, I'll turn it over to Amelia to describe more about that contest, and maybe Jolie can put in the, oh, she's already done it. She's way ahead of me. She's already put the website in the chat. So go for it, Amelia.
Yeah, sure. Thank you, Kate. So we put together a world building competition really based for exact same reasons as the Blue Sky competition. The idea that we need better ideas, positive visions of the future that reflect people's visions of the future, futures that they would actually want to live in and get excited about, and futures that incorporated technology of making the world sort of a better place. And in our competition, we focus pretty squarely on AI and powerful AI. And this has gone right. We've built powerful AI. It's 2045. Tell us about the world that you live in. And so it was really exciting because we got entries from all over the planet. So we had dozens of countries represented, all ages represented. And as part of it, they would have sort of day in the life stories. That was one element of the submission that would say, tell us about the day in the life of someone, two different people. And so we've had stories spanning the ages and spanning the geographies from all over the world. And it was really exciting to see, for me, the different visions of how people live, and this idea of sort of the multiple generations coming together was really central in a lot of those stories, which was exciting for me. So in a lot of these stories, we had people living longer. We had sort of solved a bit of longevity in those stories. So people living, imagine, you're living your health of being 40 years old, but for another 80 years. And now you're navigating a world where you get to meet your great-great-grandchildren or your great-great nieces and nephews. And like, there are all of these sort of generations coexisting, and like, what does that mean? Or in some of these stories, people were on sort of their fourth or fifth career, right? Because they just kept learning things and resetting and redoing things. And it was exciting to learn something new. And also thinking about memories and how many sort of reflections on, the memories of sort of the people they've known, and like the set of memories just being that much richer for having lived longer and having had all these diverse experience. And what does it mean to like enrich the memories that we have? Those are some of the vignettes that like really stuck out to me on like the older adult side of it.
Yeah, and I encourage anybody who's interested to go to the Future of Life Institute website, and you can read about the finalists, I guess, in this contest and the worlds that they developed. They also had to develop a piece of media. So there's some interesting media there, and the day in the life is super interesting. And then I guess lastly, a couple more things, but one is I want to address a little bit the question, even though it's not specific to our topic today, but the question about developing AI for weapons. That's already kind of happening. It is happening. It's not kind of happening. And I think this goes to just AI development in general, like where are the ethical lines? We talked a little bit about sentient, I've read op-eds or newspaper stories that were written completely by an AI, or I've read like the chapter of a novel that only the writer put the first sentence in and the AI wrote the other thing. And I mean, there's still a few little flaws, but for the most part, it pretty much sounded like a human wrote it, but then where do we draw that line ethically? And are there groups out there looking at this and trying to, put some guidelines in place?
Yeah, I mean, I was going to ask you, because I think this is my question as I'm, thinking about this from, thinking about policies and thinking about, technology in the home. What are the regulatory bodies oversight? Because I think that is like, when I think about weaponry and AI, I mean, there needs to be some level of regulation. So I'd love to hear that as well about what you're seeing on the horizon and who's responsible for monitoring this.
Yeah. So this is a lot of the heart of what we do at the Future of Life Institute is, we're a bunch of technologists very excited about the future with artificial intelligence and all these amazing things we can do. But we also recognize that there are some real risks that we're talking about here to society if we don't do this the right way. And if this is not done in a way that is both ethical, but also safe in terms of building more and more powerful systems. So a lot of the work we have done has been on the weaponization of AI. And that conversation has been happening in the UN and at different fora. And we've really seen just sort of this arms race to try and integrate AI into weapons systems, which introduces a whole host of challenges. And that's an international policy conversation that is very active, but in terms of meaningful regulation, we haven't really seen all that much come out of it. What we have seen, thinking of AI and its use more broadly across a host of issues where safety and ethics are at play, from AI's use in healthcare to AI's use in society, is a lot of work has been done on developing general principles for AI. So multi-stakeholder principles, there have been numerous sets of those around AI safety and ethics, now that have gone all the way up to the OECD set of principles on AI, which has kind of been like probably one of the most widely adopted ones, but we've seen places like China do the Beijing AI ethics principles, the DoD do their own, in the US do AI ethics principles for defense. So I think there is definitely a conversation of we need to be aware of the risks of this and also aware of the ethical considerations here. We're still at the principles phase and we haven't really moved to the regulation phase yet. And that's really the big task that's ahead of us and that we work on, quite tirelessly. And we need many more people working on. But I will say that there's really great ethical guidelines that are out there that, especially for people that are thinking about writing this, they can be nice sets of guidelines of like, what are the principles that underlie how we want to think about like the Declaration of Human Rights, but for AI, what does that look like? And people have done a lot of thinking in that regard.
Yeah. We have one last question, which I'm going to modify slightly. And the question was about, do you really think AI can get to a point where it can end mortality? But I'll modify that to say, do you see, I mean, you touched on it a minute ago, Amelia, just, you guys sit around and think about what would the world be like if we all lived to be 100 or 150 or, beyond. And I'd love to hear from Sarita, because I'm sure you guys think about this from a different point of view. But both of you, sort of what would you like to see? I'll say, what do you see coming in reality in terms of us all getting older, living longer, et cetera, whether it's AI or, I'm sure AI will be involved in many ways, but also then what would you like to see depicted? Because we're talking to storytellers here today. So those are two questions for both of you as we wrap up.
Yeah, well, I'll be brief. I do feel, well, first of all, there's a statistic that came out from the Stanford Center for Longevity that says if you look at 5-year-olds right now, their projections, this is demographers who predicted that 50% of them will live to 100 or older. So if you look at the 5-year-olds today. So we are in this journey of, assuming things don't change, but that's the prediction. So we have to have so could AI one day, I think it's going to be an enabler of being able to help us really think, Amelia talked about it, the ways to predict how to advance drug development in terms of, enhancing longevity. So I think we're going to see these these transformative, solutions because of the advent of AI. So I mean, my feeling is what I'd like to see is AI really shape it so that we're not relying on institutional care like hospitals and nursing homes, that you have much more enabled technology and assets and, avail to you in your home and in your community. And I think that's what older adults want. If you ask them, that's what they want. That's why we are rooted in person-centered care options. So that would be the future, is everything's kind of around you and availed to you through the use of this important technology.
I'd agree with that, Sarita. I'm really excited about the opportunity for AI to, as of today, you say it's going to increase our lifespans and it's also going to increase our health spans. And I think that part's really important too, because if you ask people like, do you want to live, to 100, 150, 200 years, like get out of that escape velocity, enable us to live longer, people kind of say, if I'm healthy, right? And so I think that is a big part of it, is like, I think increasing our number of healthy years is already happening today. And I definitely think that AI has the potential to help us live dramatically longer than the lifespans we live today, and in a way that is healthy. And I think that is a very exciting thing in terms of like the possibilities that it opens up. We touched a lot on that in this conversation, but also just like how we get excited and think about the future. At the Future of Life Institute, we think a lot about how we tend to think only in our biological lifespan, or maybe ours plus our children's. But if we start thinking about the world in terms of these longer time horizons, because we're going to experience it and we're going to meet our great-great-grandchildren, how do we think about all the other things in our society that we may say, oh, that's a problem for tomorrow? Would we actually start thinking and acting on a lot of those things today? It's kind of a piece of what living dramatically longer could change in all aspects of how we live.
That's a fabulous place to end almost, because it is really true. All of us have said, oh, well, I'll be gone by then. I don't need to think about that. But what if you weren't? What if you had to explain to your great-great-grandchildren the choices you made, or the lifestyle you led, or whatever? So that's super interesting to think about that. And it can be extremely hopeful too, and great. Well, thank you both. This has been fantastic. Any last words, Sarita? Any last words to that?
I just want to say thank you for the opportunity. I've actually learned, I think, more than I spoke. I think I learned a great deal just from this conversation, and it spurred a lot of curiosity and interest. So I really appreciate and very excited about the prospects and the future. So.
Yeah, well, thank you. And thank you, Sarita from the SCAN Foundation, and Amelia from the Future of Life Institute. Anybody who's interested in speaking to either of these experts in more detail about a project you're working on, just let us know at hollywoodhealthandsociety.org, and we can connect you directly with them. This will be recorded and on our website. So if you missed it, or you have friends or colleagues who missed it, you can let them know they can find it and watch it on our website. And please, if you're interested in the Blue Sky script writing contest, go to hollywoodhealthandsociety.org and take a look. And thank you all. Have a wonderful rest of your day.